The Cabinet Secretary nominee says she is up to the task and will deal with the challenges affecting the docket. Dr. Mulongo, who, if approved, will be joining government from an international organization, will be wading into the murky waters of Afya House, and the vetting committee members feel her diplomatic approach to issues may not work. NTV's Helen Aura tells us more.
The looming crisis in the health sector continues to expose the rot and administrative instability. The 56-day countrywide doctors' strike saw medics show their discontentment for the previous administration.
I, Dr. Deborah Mulongo Barasa.
Now, Dr. Deborah Mulongo Barasa has a huge task ahead of her, but is she prepared in the event of another doctor's strike?
Indeed, the doctor's strike has been a challenge over time immemorial, and every cabinet secretary has dealt with that challenge. And so there's need to look for long-term solutions. I believe that the long-term solutions are with us. So we need to work together with the unions, the doctors themselves, the interns. We need to work with the bodies, the Ministry of Education, among other stakeholders, to come up with a solution. I don't have a solution, but what I am saying is we need to have a situational analysis and be able to develop action plans following that.
The recent debacle regarding the shift from NHIF to SHIF, a move which a 3-judge bench suspended, and now Kenyans are still struggling to access healthcare through NHIF. Majority Leader Kimani Ichung'wah pointed out the ailing National Hospital Insurance Fund, with staff colluding with hospitals to defraud not only Kenyans but the fund. The grilling process today revealed a soft diplomatic approach by Mulongo, despite the problems that have riddled the health ministry.
My approach is a consultative approach involving the multiple stakeholders, from the PS's Director General, the National Technical Working Groups, the NHIF, among others, including the community who are receiving the services. And with this, we need to conduct a situational analysis to understand the challenges, and from there come up with interventions and action plans.
Mulongo will be moving to the public sector from the private sector. The transition will determine whether she will swim or not, should her nomination be approved, with members of the vetting committee pointing out that what worked in private sector may not necessarily work in the government, more so in such a ministry.
Thank you, Honorable Member.
Honorable Mule.
Honorable Mule, my sincere apologies for that.
For Mulongo, the tension probably put her on edge, despite the vetting committee introducing itself to her. She referred to them as Honorable Member. While Mulongo wants to take the diplomatic route, if appointed to be a cabinet secretary for health, her administration may have to change tact on how to deal with the cartels that have invaded the ministry. Helen Aura, NTV.